think we can go ahead and get started. So welcome everybody to today's monthly MENA Social Policy Network webinar. My name is Nicola Jones. I'm a Principal Research Fellow at ODI. The title of today's webinar is a proposed global funding mechanism for social protection. And I'm really delighted to welcome our guest speaker, Dr. Zina Nimeh from UNU-MERIT. This is a hugely topical issue, and I'm very much looking forward to the discussion. So before we get started, I'd just like to mention a few housekeeping points. So the session will be recorded, as would have been highlighted when you registered. If for any reason that you would not like your name or image to be shown, please do switch off your camera, and you can let the team know by contacting the MENA Social Protection Network email, which we'll see in the chat shortly. And then we would ask that you kindly remain muted until the question and answer session at the end. You can be typing your questions in the chat throughout the presentation. And then once we open up the Q&A after the presentation, feel free to raise your hand on video or to use the icon. So just in terms of timings, Zina's going to provide a presentation for about 30 minutes, and then I'll open up the floor for your questions and answers, and we'll be aiming to close punctually at 1 p.m. So before I hand over the floor to Zina, I'd just like to give a brief overview of her bio. So Dr. Zina Nimeh is an associate professor of public policy at UNU-MERIT and Maastricht University, and has a focus on social protection. She has over 2 decades of professional and academic experience in the areas of public policy, social policy, public sector reform, and governance. She obtained her PhD in public policy and policy analysis in 2012 from Maastricht University through a Marie Currie research grant. Her content area of expertise is on public policy, social protection policy, and financing. She has extensive expertise in the MENA region, and her teaching has also focused in these areas. So without further ado, Zina, it's wonderful to have you here, and very much looking forward to your presentation. Thank you.
Thank you very much, Nicola, and thank you very much also for the MENA SP group, especially to Rana and Olivia and also Islam for all the nice prep work that they have done. So, and for inviting me today. So I'm very excited to be here and to share sort of these ideas and work with you, with specialists also in the field, and sort of also I see it as an opportunity to discuss and get your feedback on some of these interesting ideas. So the title of my presentation is a proposed global funding mechanism for social protection, and I changed it to a question mark because, you know, this is something I would also like you to as well reflect on at the end of the presentation. But yeah, so starting with, I mean, we are always bombarded with these numbers, right? That we know that more than 4 billion people worldwide still lack any form of social protection. We know that less than 30% of the global populations enjoys an access of comprehensive social security. We are also too familiar with the effects of the pandemic and how it revealed the exasperated the need for social protection and showed the social protection gap. We're hearing now about, with the Russian Ukraine conflict, weaker growth, stronger inflation, and also we hear about a global food crisis. All of these things show us how important it is, and I think this is why we're also super interested in this topic. And a very interesting piece of information that's always thrown there, and that's from a few years ago, not the most recent World Social Protection Report, but we say that it actually takes less than $78 billion to establish a social protection floor, including health care. So, you know, the discussion has been there, and we are very aware that a lack of social protection leaves people vulnerable to ill health, to poverty, to inequality. And denying this is actually denying a human right. And it's important to point out that many countries have come a long way in strengthening their social protection systems, but major efforts are still needed. This is work in progress, and this is what we are here and what we're trying to do. Maybe just to give you a bit of a background on the work, and I like to start with this idea of advocacy efforts, which is very important, and it's really the reason why I'm also personally here. And as I said, social protection is an important investment, and we know when we even work, a lot of us, on how it increases productivity and human capital and fostering all of the domestic demand and promoting political stability. But we do face extensive coverage gaps, especially when we look at geographical areas, when we look at Africa, Asia, and also the Arab states. So depending on the specific regional and country context, one of the major obstacles in extending coverage is the lack of, or sometimes even perceived lack of, fiscal space. So I don't know, several of you might know this, but actually in 2012, 14 NGOs from all over the world participated in a workshop in Geneva in Switzerland on the ILO social protection floor to lobby for strong recommendation. And the aim of the workshop, which was organized by the Geneva office of the Friedrich Ebert Stiftung, and I'm so glad that my dear colleague Hayo Lans is here with us, was to bring together NGOs from the global south and the north to discuss strategies for supporting stronger ILO recommendations. As a result of this workshop, a joint statement of these NGOs was written to support an adoption of a stronger autonomous ILO recommendation on the social protection floor. And you can find all of this as open access online. And many of you also are familiar with the ILO recommendation 202, which the global community of nations unanimously decided to adopt or endorse, and concerning the social protection floors. And we started to see also with the SDG target, the 1.3, implementing nationally appropriate social protection systems. And also, if some of you who followed the June 2021 International Labour Conference, where ILO was asked to, quote unquote, initiate and engage in discussions on concrete proposals for new international financing mechanisms, such as the Global Social Protection Fund, which could complement and support domestic resource mobilization efforts in order to achieve universal social protection. And here I want to really highlight the role of advocacy, the role of work that we also do in terms of pushing for these agendas, because sometimes there are opportunities that arise for the right moment. And while we might be doing this work that I will be presenting, we don't find the right moment of it. Being ready and being aware of the consequences is always useful, because I think that the opportunity, we never know when the opportunity might arise. So what does that mean when we talk about a mechanism for a global fund for social protection? Now, it stems from the idea that a governance structure for such a mechanism would be based on the principle of national ownership, meaning that decisions concerning programs, definitions, and priority remain the responsibility of governments so the fund giving recipient countries, but it would leverage on existing administrative structures, and as well as coordinating with development and humanitarian aid organizations, for example, that would be active and functioning in the country. So based on these principles of national ownership, the fund would support the introduction or finalization of national social protection floor. It will ensure that national social protection floors are sustainable and resilient in the events of shocks that affect the communities, and it would co-finance, and here I would also put on a transitional basis the cost of setting up or completing social protection floors, particularly in low-income countries where such transfers would require very high shares of the country's total tax revenue. And finally, supporting and strengthening domestic resource mobilization. So technically, the fund would allow recipient countries to gradually increase their own levels of funding devoted to social protection by also identifying new sources of domestic revenue and ensuring sustainable levels of support to the countries to these programs. And here I want to stress the word sustainable. And generating evidence becomes a very important part of advocacy and sort of arguing for such an idea. And to support this debate, the Friedrich Ebert Stiftung actually commissioned a study which we became a part of as the UNU-MERIT, with an objective to support these discussions and start to discuss also the feasibility of such a fund in particular cases. And the goal of the study, which I will present a very, very small highlight of, was to generate evidence on the cost of a global fund for supporting for a period of 10 years, and also what the redistributive effect would be in terms of poverty reduction and reduction of inequality on the cases we looked at, and also what the effects of the global fund would have on achieving social protection related SDG targets by those countries, and what would be the effect on the resilience of the countries in the event of a future crisis. And here I would like to, this has been very interesting and long work, and it is teamwork while I'm presenting it. Again, I mentioned Hayo already, but also this work would not have been possible without the guidance of Michael Cichon, who many of you also know very well, who was the former director of the Social Protection Department at the ILO, but also the researchers that I work with at UNU-MERIT, Giulio Bordone, Guido Heinz, and Mitya Del Bono. So we were a very nice team that had actually a lot of fun doing this project, and moving on to more. So the case studies, and there was a lot of discussion also on how we wanted to select the countries that we looked at. We explored the feasibility of, how can we actually generate evidence based on these cases, but ultimately the choice of the countries came as how do we see a social protection coverage gap that is very persistent in these countries. Also, we tried to look at sort of a geographical coverage for the study, but also, as you all know, what data is available on a micro level and a macro level, because that was very important for the type of modeling that we wanted to generate. So here, and here I'll try not to get too technical about this, and the report is not hopefully will be launched in the fall. So you will have all the details and all the information on how the different models were generated. But just to give you a small description on that, it is a complex model. I mean, that's a very complex topic that has so many layers, and no matter how much you try to infuse it with different items, it still is parsimonious. However, the analytical framework for costing and estimating the financing, as well as the redistribution potential of the proposed reforms that I will discuss in the next slide, had many aspects. So the main components being the macroeconomic model and a micro simulation model that was static, which were used for the fine-tuning of the estimation results under various scenarios that we looked at. In particular, the static microsimulation model analyzed the extent to which the implementation of proposed policies has a redistributive effect or potential, mainly on poverty and inequality. Now, these are performed on representative household surveys that most were actually openly available. And that was a very interesting thing also, because we used open source data available without any, so we were not actually in any communication with the governments per se. These were data that were available, whether through the government portals or through ILO databases or different project databases. And for the prospective cost of the policy packages, as well as the hypothetical mechanisms that we wanted to employ for the financing, these were estimated by a macro model. And the information was drawn on data from national and international sources, as I said, and forecasted for the defined projection period of the 10 years. And another point that I wanted to mention, that the macro model also included the possibility of modeling exogenous shocks, either on an economic scale or on the labor environment. So for example, during the COVID, we had an employment shock because there was a drop in employment. So just to give you an example. And then finally, when we wanted to look at the estimation of social protection expenditures, that was based on a proposed package that was analyzed in comparison to government capacity with respect to its fiscal environment. And ultimately, we estimated financing options in relation to national tax-based revenues, sovereign debt management, and development assistance, as well as other key parameters. And like I said, sometimes we have a problem with data, but I think maybe in the case, it was maybe a problem with accurate data, because there is a lot of data. Sometimes weeding through was the challenge. So what we did, we had several proposed packages that we looked at, and we sort of tried to test and check what would actually be the most feasible. And we simulated various social protection reform variants, both on Uganda and Nepal. And as you see here in the slide, I included that there was a universal package. We called it the UNIV package. And what it aimed was to provide a set of universal benefits, such as universal pensions, child benefits, essential health services delivered by public providers. The second variant was more of a targeted nature, and it assumed that the existing individual poverty gaps could be closed by social assistance benefits targeted to the poor and coupled with essential health services, again, delivered by public providers. Similar to, we use the social protection index methodology, and that methodology is also available online. If you are interested to read further into it, there's a lot of references also available on that. And both packages also included the same health components, and we projected that for, and I'm looking actually at the time, I'm almost out of time.
You're doing fine.
Okay, how much time do I still have?
You're only about halfway through, you're fine.
Okay, good. All right. So you just let me know if I'm at my 15 minutes mark. So I will try to be. Okay, so apologies for that. Now, so the health costs with this, we put that at 3.7% of the GDP. But again, the difference was in the core social protection component construction. Now, looking at the macroeconomic context of Uganda and Nepal, the analysis provided also an additional universal package. We use that, we call that the universal modified package. And we adjusted the parameters based on assessing affordability, realizability, and also the ex ante of both universal and the targeted packages. All universal package benefits were expressed as a share of the national poverty line. And in all of the cases, a set of existing programs already in place are maintained or expanded. So we also took note of that over the projection period. And maybe one more point I would like to mention here is that the available national poverty lines were also used as a main benchmark for determining the benefit levels for the packages while considering the existing national social protection floor components. And we looked at, what we used is also the concept of the guarantees. So we were looking at benefits for children, maternity benefits, disability benefits, at all the different life cycle, vulnerability life cycle stages. And also, with the essential healthcare, we took into consideration different estimations by the WHO. And a lot of the methodology also was borrowed from the social protection floor index and how that was generated. So, of course, I will be very happy also through the MENA Social Protection Network to share the report once it is out. And we would be happy to have also more discussion on the particularities of the methodologies and all the models that we use and the equations, which probably is better suited for another time. But here I just wanted to share And this is only for the modified universal. So that was sort of the next phase as I discussed. And what you're seeing here is the results from the two countries and highlighting the most relevant elements. So if you take the universal road to social protection, it actually does ensure a sizable redistribution and poverty reduction by implementing the modified universal package reform. And looking here, the poverty headcount reduction would range from 34% in the case of Uganda to 64% in Nepal, and the poverty gap reduction would be from 42 to 76%, as you can see. So a universal set of benefits, despite being distributed horizontally, would be more impactful in reducing also welfare imbalances. If we look at post-transfer numbers, so the Gini also changes. In the case of Nepal, goes from about 37 to 32, and in Nepal from about 35 to 34.8. So a universal reform would then attain the significant redistributive social justice results that both countries would actually administer the path of going on to the achieving SDG 1.3 and others. Now, another graph that I would like to also share with you is the global contribution of government additional resources, and just walk you quickly through this graph. So the graph shows what the fund's contribution, that would be the blue line. And as you can see, it tapers off through time. So the idea is that the fund would start supporting, and then eventually you are building also resources through various outlets in those countries. And then you have the new mobilized resources, that would be an increasing line for the countries. And then you have the total cost that goes through time. And of course, this takes into consideration demographic changes and labor market, etc. So the analyzed 10-year projection that we looked, the global commitment would be expected to contribute about $15 billion to finance the implementation of the package in Nepal, and about 18 billion in Uganda. And these resources could be matched by the nationally mobilized resources in 2025 in Nepal and in 2028 in Uganda. Of course, you think, wow, huge numbers, but we will get to that. Now, in both cases, the fund plays a very essential role in financing the additional social protection expenditure during the startup phase of the new benefit packages. And there are different numbers of maximum disbursement from the global fund, but then these would be sort of spelled out so for example, they would also peak at a certain point and then start to taper off. Now, keeping in mind a time-defined contribution from global partners who would partake in this fund, a relevant practical matter lies is that whether there is actually or will be sufficient domestic resources to be mobilized, and what would be the actual time frame. Now, keep in mind, we had this for 10 years because we just wanted to look at this period, but that doesn't necessarily mean that's the only period or but that seemed the most reasonable. Also, when we think about how short term sometimes these ODA programs are, or similar programs. The initial implementation of reform policy partially also relies on the guaranteed financing pledged by global contributors. But it also would eventually depend on national budgets. So, for example, in the case of Uganda, we would estimate that Uganda could cover the entirety of the additional cost in the long term by raising revenues to the regional taxation average. So at the moment, it's much below. So if you start a program with increasing the taxing average, that could actually sustain that. Now, moving beyond this point to what I call the advocacy element. Now, the idea here is that if constructed and supported properly, that the global fund actually has the potential to reduce poverty, as we said, and inequality and insecurity. And for those of you who might have attended the Global Forum for Human-Centered Recovery, in the opening statement, the Director General of the ILO actually remarked how for the response for the COVID pandemic, the the fiscal expenditures, the fiscal response was actually about $19 trillion. So if you think about this in terms of, wow, this is a huge number, think about how actually much we generated after the pandemic took place. And so this is a point I would like to come back to. So, and of course, the costs that I am mentioning, they are pretty high. But again, here, this is, a very, very common sentence. What is the cost of not doing anything? So ultimately, the belief here, or the sort of the push from advocating for such a fund is actually that the strength in cooperative efforts to ensure that there's an adequate investment for social protection is not just rational. It's the only sustainable way. And it's actually, if you think of it from a human rights perspective, that is the ethical choice to proceed forward. So where do we go from here? And the interesting question, so like I said, we have the study shows it's doable. We know what the numbers are. We can budget for them. We can, this is can be pretty clear. But then is it a question of resources, or is it a question of support or political will? And when we talk about resources, these are just numbers I kind of just checked before for our presentation. Actually, the World Bank group, which is partly the World Bank, but also the part that I think there are 5 parts of it, including the World Bank itself, but actually delivered 204 billion in financial support to public and private sector clients in the 2 calendar years of the pandemic. And as I mentioned before, the global fiscal support to fight COVID has reached 19 trillion. And then the question, as I said, becomes an issue of support or political will. Is it really feasible or realistic to think that a standalone fund could be portrayed as providing a partial answer to long-term social development strategy? And here I would invite you to think about other funds. For example, we have the funds of AIDS and tuberculosis. I mean, it is part of a health architecture, but it's a fund. It's a standalone fund that still goes on and was very instrumental in where we got today in those outcomes. Or is the idea too complex to implement? Now, the core of the problem for support of a national social protection floor initiative in recipient countries, which distinguish from most other development projects, is that it has to rely, and that's a very important point, on a very substantial level of stable and reliable resources for a number of years. And that technically exceeds the capacity of a single donor. Additionally, if we think about financial commitments for a country support during a period of time, it is subjected to a lot of variation. Those of you who work in ODA, that you know that. Sometimes politicians change, sometimes agendas change, priorities change. And for you to see that notable social effects from programs such as social protection, these short-term incremental infusions in assistance are not, they will not get us to that ultimate goal. And taking the pandemic, yes, we had a lot of resources that were mobilized, but also ODA fell, especially that a lot of bilateral donors had to focus on their own issues. And here goes, again, I go back to this issue of advocacy and talking about it and discussing this. So actually, this is in the heart of a lot of the work the Global Coalition for Social Protection does. But also, if you read the reports that came out from the UN Rapporteur for Extreme Poverty and Hunger, and also the International Trade Union Corporations, that is the proposition to create a solidarity base, which is the Global Fund, because it is not just to fund, but it's also to help in the designing, the implementation, and in specific cases, financing. But then how do we prioritize? There is an international recognition and support for the concept. And there is support from a number of national governments. That changes, of course, depending on the national governments, but it's also at the ILO. But then again, priorities change as well in these organizations. So in conclusion, I would like to say that a global funding mechanism for social protection can be a reality. And it could be an instrument to make us achieve this basic human right. It has to be recognized that even with with political will, the majority of low-income countries may face huge financial requirements and constraint in the short and medium term, which could make it impossible to finance actually the social protection floors alone. But we have to look beyond the medium term. And, what is needed is on the global stage today is for us to rethink how we're doing it, because the way we're doing it is obviously not working properly. So there needs to be a dedicated financing provision that enables the global community of nations to systematically, reliably, and sustainably support national efforts of lower income countries through this form of stimulus financing. And this is what we've tried to do with the study. I think there was a slide that I had missed, not sure where I dropped it somewhere, but I think maybe I can just stop here. And it was more about the advocacy part, but that is fine. I just had a few questions that I wanted to ask, but maybe I can stop here because I think maybe then I'm okay with time, or I'm a little bit early. But yeah, well, sorry about that. Yeah, this is a little bit. No, I want to go back actually to this one because when I was talking about the advocacy part, and then I will conclude with this. So some of the questions that we also ask ourselves, continuing from what I said, is that, again, an issue of prioritization, an issue of the long-term predictability for funding for low-income governments, and how long do we look at these projection? Of course, the longer we look at it, the more expensive the numbers will be. And the last 2 points that I would like to maybe open the discussion with, and I would really like to get your input on and have a discussion on, is about how would we construct the financing? Who would we also look at sort of new ways of financing it? I mean, if we look at different mechanisms of financing, or even if you look at how debt is financed, who are the people that are more engaged in that, or which governments, or do we incorporate private sector, for example? And how do we identify the different stakeholders who would be part of such a fund? Is it something that would be just an ODA fund, or is it a fund that should actually incorporate other stakeholders? And if that is the case, how would we govern that, keeping in mind that the implementation governance, as we said, it goes with the countries. So I will actually stop here, and I'm very curious actually to your thoughts and to your ideas and questions, because like I said, this is a proposal. This is something that we are trying to push for. Maybe some of you will think this is completely unrealistic. Maybe it's not, how context dependent it is. But yeah, I will stop here, and I'm very happy to hear your comments or questions, critiques. So Nicola, back to you.
Brilliant. Thank you so much, Zina. Really fascinating findings, and I think a lot of food and questions for thought. I'm seeing that we already have questions in the chat, which is great. So maybe we'll start with the first one from Nicola Yates, who's asking whether you could elaborate, first of all, on your point about the global fund on HIV, AIDS, and tuberculosis being a good model of financing.
Yes, thank you very much for this question. I have to admit, I'm not so much familiar with the intricacy of how it has worked. What I know is that the conceptualization of having a fund as such, that is not a new idea. And if we look at the fund for AIDS, and if we look at how also the impact that it has had on moving the agenda forward, that is a good example that we can at least say that's not a crazy idea. That is a potentially possible idea that has to take its own shape and form. It has to be, how would you say that? It has to be formulated based on what goals we have for social protection, but it's been there. It's not a fund on a global scale is not something that is completely out of the question. So that would be, and I see Haya, you've raised your hand, so maybe you can also, I just think it's for that point, because please come in with me to that.
Yes, thank you. Oh, wait the micro. Can you hear me?
Yes.
Yes. Okay, perfect. Just on this point, because maybe that's a little bit of background also to the history of this Global Fund for Social Protection, because there was a lot of discussion and debate about, first of all, the name, a global fund, because of this proximity to the other global funds like on HIV, AIDS, and tuberculosis, because many civil society groups reject the idea of a global fund being funded by private philanthropists, benefactors, financiers like the Gates family or something like that. So when they heard global fund, they related it to Bill Gates immediately. Now, not to these anti-vaccination guys, but the dominance of one capital that will, kind of manage where this fund goes and who decides on what. And there were all these critical discussions. And then the other element was a global fund immediately, and for many in the NGO sector, meant a vertical fund, meaning that something comes from top to down, and the top decides what the down will receive and not receive. Our idea of the Global Fund, and we just insisted on calling it Global Fund because that was the easiest way of calling it. We could call it anything else, and we now call it actually a financing mechanism, was that we want a horizontal fund, meaning that if there is a fund, then those that receive something at least have to say as much in how it is going to spend and what on as those that give and pledge the money. So a horizontal fund was meant and not a vertical one. And so there is a lot of difference and a lot of similarity, if you want, to the one on HIV. Sorry for being that long.
No, that's great. Thank you.
And I think maybe just to add to that point, I know there's a current study going on looking at what some of the question marks might be around the Global Fund for Education in terms of whether there might be double counting of funding and issues related to transparency and accountability. So I think it may be worth it as a next step in terms of advocacy, looking into what are the lessons that have been learned from not just the health funds, but also the education funds.
Maybe I also want to just add another point to that, and I don't know if it will come in the questions, but also one of the very important ideas is that it's sort of getting this collective action to this layer, as Hayo said, with this horizontal approach, but it is about also bringing the financial element to a sustainable level. I mean, when you think about it from a more positive view, that a fund is a much longer term. It's not a program. It's not a short, it's not a short piece of assistance that is coming there, but rather it can have more of a reality that is sustainable. Of course, that brings in the elements, another set of problems, as you said, with issues of transparency, with issues of accountability, with issues of governance. But again, that is the point. This is a suggestion of how we can progress, because what we have is not functioning. So it's that sustainability element also that is inherently embedded in this idea of a fund as well.
Great. And there's a related question here. Hafawa is asking, wouldn't such a fund disincentivize governments from doing their job when it comes to guaranteeing the right to social protection?
That is a very good question, and that is why it is very important that it's a transitional fund. This is not a fund that is supposed to be. I mean, the thing is that, and this is also an issue. I mean, we do see that a lot with funded social assistance programs, that at some point the donor funding starts to stop, and it's a problematic issue. And I think here comes the important element also of capacity development, not just from a technocratic perspective, but also from sort of the larger understanding of governments, that this is not something that it's a support in order for you to sort of grow into a much more engaged approach of social protection. So that is a very important point indeed, that has to be incorporated also in the design of the context that such a fund would operate then with the government that it would do.
Great, and I see that Anton has a hand up. Anton, do you want to take the floor?
Hi there, thanks Zina for the presentation. Just to introduce myself, I'm Anton Ophil-Cohen. I direct a small consultancy group called Equal International, and we've been working on the principles of GPI, Global Public Investment. And I just wanted to share some comments because I've also been involved in helping to establish and promote and advocate funds such as the Global Fund, such as UNITAID, a number of different funds in my time. Firstly, what really strikes me is, whilst this is quite a nascent idea, it is very progressive. And people like us can see the logic of why it's right to advocate for something like a global social protection fund. But being really progressive, I think it's really useful to be a kind of reflective of the politics, because at the moment you've got very kind of right-wing politics and you've got very progressive politics. The right wing are currently really ambitious and are achieving things, and the left progressives aren't, which I'd say is because we're not being ambitious enough and clever enough and having a longer term view around how to win things like a social protection fund. But I just want to say something about, we've been working on kind of co-creating GPI, Global Public Investment, and essentially it's been a co-created thing, mostly from the South, through lots of convenings, and the principles that have emerged is that any new fund should adhere to the principles of all contribute, all benefit, all decide. So something like a social protection fund should have all those that are participating contributing, or according to their means, all benefiting according to their needs, and all decide. They should all have a role in the governance. For us, that's the best practice that's been achieved through the Global Fund. Mm-hmm. But we started our work in thinking about this thought leadership around the future of ODA, because the ODA model itself isn't fit for the future, actually because of the limitations of the Global Fund. So even the Global Fund, which is the best practice when it comes to shared governance, there isn't space for new donors and middle-income countries to come and be at the table, because there's a governance structure there that's already quite set. And it's just something around, when it comes to making something like this real, it's worth thinking around the long. It's a marathon, not a sprint. So what does it mean to take the evidence and build the demand, particularly at a country level, which I think is won by evidence, and it's picking the right, basically the right kind of narrative. So, for example, social protection funds, we can really see have a huge impact on the different indicators that you mentioned. But it does beg the question, it's always surprising why many countries just don't have social protection funds, national ones. So, for example, we have across Europe, we have embedded in our systems social protection funds. Across Europe, we have a sharing of resources and a leveling up. But I'm half South African, and I'm always amazed at how the South African government doesn't have a minimum income allowance, because it would take so many people out of poverty, bring so many people into the marketplace. So I think another question for me is how do you socialize this idea at a national level, build demand, but as you started to do, essentially show that it's not a radical idea, but it's completely implementable, and kind of it's stupid not to do it. So yeah, just some reflections. And what's particularly useful is, I think why I got invited to this is I'll be in Sweden next week to present at a development conference there, which is kind of driven by Swedish Swedish Church Aid, I can't remember the name, championing social protection and the Social Protection Fund. And my task there is to talk about how GPI can help promote progressive ideas like this. So that was just some thoughts that I wanted to share, and very much look forward to contributing to any advocacy around making what might feel impossible possible.
Thanks a lot.
What is GPI? I'll just pop the website in the
that's
chat.
Great.
And you can have a look at that. Yeah.
No, that's great, and would love to be in touch. I think you bring a very, very important point, and you started with that. And of course, unfortunately, we are living more and more in this polarized world of right and left. And I always tell my students a very interesting story about welfare in the Netherlands. And I say that I don't know if it's in the 18th century or what, in Amsterdam, the sewage system was horrible. It was so bad, people were getting sick. And what happened is that a collection of very wealthy business people decided to say, we're getting sick from the sewage system, so we're actually going to do that on our own expense. And what happened with the fixing of the sewage system on their own expense, the poor areas got better, people's health got better, employment became better, etc., etc. So you bring a very important element of the private sector. And I think what I am seeing as well from at least from the academic perspective, and I think we need to start to look more into that, is this infusion of public and private, because it's actually very inaccurate to say that the social protection and the well-being of people that are living in a lot of the low-income countries is just a question for their own governments. And you see some examples, for example, Nestle right now with the programs that they're doing in education, but these are all very philanthropic efforts, or they are efforts that the government, the corporations are doing because they're great or their benevolence. And I do think this is a discussion we have to start pushing for. Who leads it? That's another question. But I think what you say is very important, and I would say that would be sort of the next step in sort of. And that's, I think, going back to Hayo's point, this idea of fund. Fund is not necessarily a bad thing, but fund could also, we are in the MENA region or the MENA SP here. So if we look at the MENA region, a lot of times when governments say we're going to do a fund, it's this black box that the government is going to put all the money in, and we're never going to know what it is. So where's the accountability? So all of these things become very important. But thank you for your comments.
Great, thank you. So I see we have a hand up from Ursula, and then there's some related questions from Rana that I think would be great to answer if there's still time. So Ursula.
Thank you very much. Thanks a lot, Zina, for the very interesting presentation. And I think it was a very timely presentation because it really keeps the ball rolling. And the discussion about the Global Fund. And I wanted just to tell you that the office, we also undertake research on the relevant experiences in setting up global funds in other thematic areas. And we will also initiate discussions with international organizations, with governments, social partners, and other relevant stakeholders on the concrete proposal for a new international financing mechanism. And finally, we will also develop a feasibility study, which will be carried out in the next months and should be finalized before the end of the year. And this feasibility study aims to present various options for a global financing mechanism to complement and to support domestic resource mobilization efforts, and so as to achieve universal social protection. So the ILO is also working on this issue, and in fact, it was this work was also requested by our governing body in November after the International Labour Conference in June 2021. So we will have the study hopefully at the beginning, at the end of this year. But in light of this, and in regard of the Global Fund, I also wanted to know your opinion, Zina, about, and from colleagues, of course, about the coordination function of the fund, because in the end, we have so many different funds also for social protection. We have the fund, the SDG fund, for social protection, for example, many other funds. The ILO has now launched the Global Accelerator for Jobs and Social Protection. The ILO has also the flagship program on social protection, which is in a certain way also serves as a fundraising mechanism. So we need to, I think what is very important, that we also either, find a space within all these financing mechanisms, or include a coordination role, what I think would be better for this global fund, so as to coordinate also the different fundraising efforts, financing efforts at international level. Thank you very much.
Thanks a lot, Ursula, and I'm so happy to see you.
Yes, me too.
I have to say, I mean, that is one of the highlights that I am to seeing you, that I haven't seen you in a while. So, I mean, and I mean, for those of you who don't know Ursula is also has been one of the people in the frontiers of pushing for social protection. She's actually one of the persons that got me even more convinced to stay in this field and be there. So also being here is thanks to her as well. So
Thanks,
this is,
Zina.
I'm very happy to see you here. And I think you pose a very important question. And I think this is sort of the, this is where I would, if I would dare to say, where if we get lucky in a form of a leadership and the correct teamwork, this is where it will go. I mean, if you think about sort of the momentum that was around the social protection floor and the leadership, the political leadership that took place at that time, maybe today, if we would have tried to do this, that wouldn't have flown in the same way. I think the issue of coordination is a humongous issue. I think if you see now with the UN as well, there's this big push now for resident coordinators of UN offices, because particularly this problem. And I think that's a trick where my hunch takes me much more that actually, if it's better to start small and show how it could work in a proper way, not having the big dreams, but starting with the baby steps. Because I think if we choose the right context and we choose the right example to start something like that, taking in all what we know about good practices, but better practices, and also bad practices, because bad practices are also as important, especially when we're talking about coordination. I think that would be sort of a place where we can hold the thread. We will never solve the problems. Things will continue to change. But at least I think if we start to bring into the discussion different stakeholders, we are already heading into a different level. And I think coordination would be at the core of that. But I'm super interested to also follow up on that with you, because I think, this is the idea, is that there's a lot of us working on that. And sometimes that's why the advocacy part is so important, that it brings us all together to work more collectively towards that goal, which will make it, I think, more feasible. Thank you.
So I think there's just time for one final question, and I think quite a few people are raising this. So Sandra has asked whether it would make sense to have more of a regional or context-specific lens, particularly given differences across regions. Rana has asked something similar about involvement of regional funds. And I think because of the focus of this particular webinar series on the MENA region, it'd be great if you could perhaps close by reflecting on what are some of the implications specifically for the MENA region, both for low and middle income country contexts, and thinking also about some of the political dynamics that we'll all be discussing.
Yeah, thank you very much. And yes, indeed. I mean, the MENA region is very interesting, right? I mean, because you have the different parts of the different countries on various levels of fiscal capacities, and also potentially being able to be on the recipient, not just on the donor side of the fund, not just the recipient. So let's say you look at Yemen versus Saudi Arabia. I do think that this is a proposal that should be investigated more from a regional perspective in the Arab states, because I think here's where I don't know if I'm being controversial here, but the Arab states are extremely unequal. there's a lot of wealth in the Arab state, but it's at, even if you have the 1%, it's like, I think at the 0.025%, even less. But there's a lot of wealth in the Arab states. And you don't know where that is, because also due to national security, due to a lot of different, you know, this sort of marriage between power and authority, which is not a bad thing. This is a construction. The idea is that to convince that if you share a little bit of the wealth, it's going to be good for everybody else, but show the evidence. Show that if it is better done, again, like the example that I used for the Netherlands, it's going to be better for everybody. The issue is not a technocratic question, it's a question of politics. If you look at Egypt, for example, after the Arab Spring, but specifically after the current government has been in power, I mean, funds has been the way to go. And the problem has never been collecting funds to do things. There is always a way to get these funds. The question then becomes of a transparency issue, of an accountability issue. But most importantly, in the MENA region, it's always been about political economy. The problem is it's becoming more and more critical about it being an issue of political economy because of all the changes that we're seeing, and also because of the youth bulge that, you know, we've been saying the Middle East is a ticking bomb for the past, as far as I remember. But I think maybe with more looking at it, you say, okay, more now, it's more of a ticking bomb. I don't know. The Middle East is always interesting how it evolves. But if I'm optimistic that actually if this idea is taken on board and investigated more further, I do think that it can actually solve a lot of the issues of the problems in fiscal space, specifically in the Middle East, because it also creates maybe a new form of solidarity among these nations in a different way than how solidarity is currently working. I don't know if this answers your question, but I would leave it there.
Brilliant. Well, I think that's a great note to close on. I think all the questions have really highlighted just how much excitement there is around this topic. I think there's a lot of lessons that could be pulled collectively from those here. So hopefully people have been paying attention to all the contacts in the chat. So I'd just like to close by saying a huge thank you to you, Zina, for really a fascinating conversation today, and also to thank the audience very much for joining. And
maybe if I can just interrupt, sorry, Nicola, just for a follow-up. I mean, and I have Hayo also here. This will be published. We will follow it up also with the launch. So I will be in touch with the network to let you guys know, and hopefully maybe we will have a much more also another follow-up chat based on once you've had the report and you've taken a look at it, and then you can also be more critical. But yeah, that will be coming hopefully after the summer.
Fantastic. Well, definitely something to look forward to. So thank you very much, everybody, and we look forward to continuing the conversation.
Thank you. Have a good afternoon, everyone.
Bye-bye.
Bye-bye.
Thank you all.
Thank you.
Thank you, Zina. Thanks,
Bye-bye.
everyone. Nicola,
Bye-bye.
all the best.
Thank you.